Hey, my name is Samantha and this is Cameron. He's going to help me out today and be my patient. So, first thing I'm going to do is take his vital signs. I'm going to feel for his pulse. Can I see your wrist?
Yep.
Okay. Mommy's going to do your pulse. Got to be real still. Alright, hold on. Hold that. Okay, his pulse is 108.
108.
Uh-huh. Now I'm going to pretend to put a O2 sat on his finger, and looks like you're satting 100% on right there. I'm going to count his respirations. Let's see your tummy. Alright, just breathe normal, okay? And it looks like he's breathing 20 times per minute. Alright, Mommy's going to do your blood pressure. Here. Can I put this on your arm?
Yeah.
Here, put it in that hand. There you go. Now, in real life, I would use a much smaller blood pressure cuff for a child. Alright, it's going to give your arm a great big hug, okay?
Harder.
Alright.
Harder. No, Mommy, harder.
I got 126 over 82. Are you in any pain right now?
What?
Are you in pain? Do you hurt anywhere?
Oh, no.
No? Okay. So he scores a 0 on the pain scale. I'm going to be assessing his abdomen today. So we're just, can Mommy look at your tummy?
Yeah.
Okay. I'm just going to have you kind of lay back in the chair for me, okay? First thing we're going to do is just inspect the skin from the stomach. And we're just going to look for any types of scars, any visible veins. He does have a birthmark, a couple of birthmarks on his abdomen. We're also going to look for any type of rash or lesions. We're going to check out his umbilicus to make sure, and just look at the shape of his overall stomach. So, next thing we're going to do is listen and auscultate. Can you lay back again? We're just going to listen for vowel sounds in all 4 quadrants. Yeah, it's positive vowel sounds in all 4 quadrants, and we can also listen over the aorta to make sure there's no bruise.
What, the A word?
The aorta, it's like in your tummy. Okay, and there's no bruise. Next thing we're going to do is percuss. So, can you lay back again?
Yeah.
Okay. And Mommy's just going to tap on your tummy a little bit. And whenever you do this, if you hear a tympany, then that could be they have a lot of gas in their stomach. And dullness could be like fluid or feces. So next thing we're going to do is just do like a light palpitation. And we're just going to kind of feel the muscles. Make sure there's no bulging. And Does it hurt anywhere when mommy pushes?
No.
No? Good. So you just want to feel and make sure there's no tenderness. Okay. The next thing we're going to do is a deep palpitation. Press it a little bit harder. I was supposed to ask you to cough first to make sure you don't have pain. Can you cough? Do you have any pain in your tummy?
No.
Okay. Now you can lay back. And what you're looking for when you do this is to make sure there's no rebound tenderness. Does it hurt anywhere?
No.
Okay, good. Alright, you can sit up now. Okay. So at this part, I'm going to educate my patient about some health things they can do. So I would probably address this part to his mother, so I'm just going to pretend she's here. So if this was an older patient, I would probably ask them about if they use alcohol. You could use a CAGE questionnaire to help screen for that. I would probably educate them about hepatitis A, let them know that's transmitted through fecal oral route, and that if you contaminate your food by not washing your hands, that you can get that. So the most important thing is to wash your hands. I would educate them on hepatitis B and C. Those are both transmitted through blood. So I would try to educate them about using safe sex and not to do IV drug use. I would educate them about colorectal cancer and some important screening things they can do to identify that, like getting colonoscopies and determining if they're a high risk or not. If they're not a high risk, I would just recommend for them to start getting them after the And I could also talk to them about urinary incontinence and teach them that there's things that they can do to prevent that, like muscle training and pelvic exercises. So that pretty much concludes the video. Thank you, Cameron.
Thank you. Thank you for the spot.